Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Welcome back.
Well, this has been, if people ever heard our conversations in between when we're on the radio, they would love it, right?
I think Richard recorded them.
Yeah, just don't put the mic on, right? So I was just saying, so now this is
we were talking about, that point was Venus. Very interesting before we went on the break, about the arterial pressure, Dr. Mike, you were saying, and the venous pressure. And you were saying that the venous pressure is about 10 to 20. And the arterial pressure, let's say 120/60, would be a normal blood pressure. Now, if your blood pressure is, let's call it 120 or 130, to be different, 130/70, and you go to the doctor monthly and you get checked, and suddenly your blood pressure goes up to 150 over 80, most of us will be concerned. They say, wow, my top number went up by 20 millimeters of mercury, and my bottom number went up by 10 millimeters of mercury. Doctor, should I be concerned? And some doctor will say, yes, it's a big jump, and that is of concern. But you are saying, Dr. Mine, for the vein, we don't have any equipment that we can monitor the blood pressure for the vein.
Yeah.
Can the vein take a hit of 20 millimeters of mercury and continue to live happy ever after?
To answer the question, I'll probably say probably no. But, so what we're dealing with the arterial system is very high pressure, very low volume, right? And the venous system is very low pressure, but very high volume. So there's a lot of blood there, but it's under low pressure. And so we don't really have a way of measuring pressure on the venous end, and that's something that there's researchers working towards trying to figure that out. But the only way to really do it now is take a needle, put it inside the vein, hook it up to a machine that'll test it, which is invasive. Nobody wants to be doing that every time you go to a doctor's office, right? And it also depends if you're standing, if you're 10 degrees, 20 degrees, 40, 90, if you're sitting down. So it changes drastically depending on the position that you are. If you would take normal venous blood pressure and double it, you probably have such a severe occlusion somewhere in the vein that the blood cannot return from your leg, because there's no way. Even we believe that even one going from 10 to 11 or 11 to 12 or 12 to 13 makes a huge difference, because it's going from 10 to 11, that's 10% increase. If you did that on the arterial side, if you went from 120 to 132, that's 10%. That's a big deal.
Mm-hmm.
So we're not sure how the blood pressure on the venous end matters as compared to some of the other things, right? So this is, when we talked over the break, this is a very new, interesting field, and that is, I flew out to Minnesota, one of the largest companies probably in the world manufacturing devices, and they said, we've created all these devices for treating the arterial side, but we've completely missed the market on the venous side, and all these companies are jumping on it. And there's a couple of reasons for that. One is we've realized how many patients there are that have the disease. But two, the insurance companies are starting to pay for all these advanced treatments of venous disease, which they haven't before. And there's new procedures. We can actually go into the veins and look from the inside to see what's going on. And so these new, everything's being driven together. The industry's driving it. The insurance companies, patients want to be treated. We see these patients with horrible disease, and we want to treat them. We want to do something more. So I think we're going to see a huge revelation. We're going to see a lot of changes coming up in the next, we already are now, but in the next 5-10 years, where we're going to say, okay, well, for each one arterial patient, there's about 5 to 10 venous patients. So we're missing this venous disease. Okay.
Well, I was also, right. This would be very good. You're right.
Yeah.
I'm sorry. I get so involved with our guests and Dr. Mencia. It'd be good to say who's on here, right?
Yeah.
So Dr. Mencia, of course, this is the wonderful world of wellness. And if you would like to go today and talk about any of this, you can go, because he's always open on Saturday. He's over there on East Commercial Boulevard at 1600 in Fort Lauderdale. And his phone number, get your pencils out. Most of you have it, but new ones who are listening maybe don't. 954-489-1345. And I'll repeat that, 954-489-1345. They also have another office in Boynton Beach on Agan Ranch Road. Their number there is 561-270-6494, 270-6494. And you've been listening to Dr. Luke Mai, M-A-J, and he is a vascular surgeon practicing at Water's Edge Dermatology, but he does work, of course, with Dr. Mencia. That's why he brought him here. So if you have any situation, you can go to Dr. Mencia's, and Dr. Mai would come there, and you'll make an arrangement.
Well, he has a schedule all set up. So
really,
yes, and we do the ultrasound, we do the vein study. But for the patients, there are patients that they are so happy with their primary care doctor, and they need Dr. Mai. They might not need me. So
they are
welcome.
Don't say
they are
that.
welcome to make a call and say, I want you to set up an appointment for me to meet Dr. Mai at the office and have a consultation. Especially those patients that have, let's say, Medicare with a secondary, or you have a open access insurance where you can go and see any doctor you want to. If you have an HMO or something, then you need to call your primary care doctor and try to get a referral to come and see Dr. Mai. We have one case of one patient that we saw, and he was Medicare. We started the procedure on one leg, and he come to me, and he said, Dr. Mencia, I feel so great. I went back to my country, to Dominican Republic, and I walk all over, and I think he got his right leg or left leg. He got one of the leg done. And he said, that leg feels so good, but my other leg need to be done. And they say, okay, don't worry. He's going to probably put you on the schedule, and he follow through because you cannot do everything in one shot. You have to go step by step. So he say, my wife now got Medicare, but she signed up with this HMO and she signed me up. So now I cannot see Dr. Mai. So he goes, I will pay out of pocket. How much is it? That's how happy, I swear to you, that's how happy this guy was. And I say, listen, we don't want you to pay out of pocket. You have insurance. We want, your insurance should cover for this. We're going to continue to fight with the insurance. He said, the heck with that HMO. I'm telling my wife to get me off from the HMO. I'm going back with my Medicare because I'm going to get my leg treated.
That says a lot. And there's a man. See, there's the man that didn't come to you.
I like seeing new patients. Sometimes I see a patient Dr. Mencia hasn't seen. And the thing is we convert them over to our synergistic plan is what I see.
Right.
And that is, you're not only coming to see us for veins, you come to see us for other things. And a lot of times we notice things that are going on. But in terms of these patients that have the HMOs, I see a lot of Humana HMO patients, and we try to work with the insurance as much as we can. We try to work with the primary care physicians as much as we can. And we go, this is all I do. I know this market inside and out. We know about waivers. We know about things that we can do. A lot of times we can go to an insurance company and say, look, this patient needs to be treated. You don't have a provider in the area. That works really well. We actually get waivers and we can treat the patient. So we have ways of working around it. I always say to patients, come and see me. If I cannot do something for you, and if your insurance won't pay, I won't even charge you for the first visit. For me, that education is a big part. If I can educate you and you know what you can do and how to feel better, that's going to be leaps and bounds beyond what I can do for you, or you can help somebody else. And I've actually had patients who've come in and I said, look, I can't treat you. There's no way that I cannot get this through insurance, but I have a colleague in another location. I sent him there, and actually that patient has now sent me 4 of their family members.
That's amazing.
It's just insane.
So while you're here, I have a question for you.
Sure.
We're talking about veins in the legs. Why do I have veins in my hands, which a lot of people don't? Why are they so pronounced?
I have veins in my hands too, I guess.
Yeah, me too.
Yeah.
So what? Yeah, but mine are larger. Some people don't have them. Where do they come from?
Well, so one
Sorry,
thing is, people who work with their hands a lot tend to have larger veins, and that's because when you work with your hands, there's a lot more blood delivery via the arteries. So then the venous system has to enlarge and get bigger to handle all that vein going back. But what's interesting is that I have a lot of women who are, I don't know, I'm not going to give an age, but I have women who come in and say, I can see my veins more now than I used to. And I said, well, that's another reason for that. And that is because you're losing a lot of the tissue, losing a lot of the fat and some of the muscle. And so what happens is those veins are more visible. And that's also a treatment we do. We actually do just an injection of a sclerosin in those veins and we can close them down.
Can you really?
Yeah. It's a simple and office
Well,
procedure.
I guess I know where I'm going, really.
And you know what I do?
What?
You
hold their hands.
I take them to the spa.
Right.
And then, no, I'm serious. There is a procedure in aesthetic where we lift the skin up like this. We stick a needle and we take filler. The filler we put on the face, we take filler and then we spread them out. And that filler will will work as that collagen that is missing from the skin. Because what the skin now has turned out thinner than what it used to be as we age. So the vein become more prominent. But the veins are always there, just that they become more prominent.
That's very interesting because I have patients who I used to treat and I used to take care of their veins and they would come back and they would say, I don't know, I still don't like the way this looks. And with another dermatologist, I would have him inject the filler, like you're saying.
Yes.
And so now my approach is a little different. I say, well, is it the veins that are really bothering you, or is it the in between the fingers here, you're kind of losing some tissue? And the patients start thinking, and if it really is, and it turns out to be more, it's not the veins that are bothering you, it's just the way that the architecture of the hand looks. And I think the fillers are doing a better job than, and sometimes patients say, well, I want the veins gone and I want the filler. But I always explain it to them. It's like, what is it really that's bothering you? You want to get down to the root of the problem.
Maybe it's a good time to talk about Stonewater Med Spa. Dr. Mencia has recently taken over a very famous spa. It wasn't a med spa before, and now it is because Dr. Mencia is the medical director, and it is located there in East Oakland Park Boulevard. It's fantastic. I'm still got to now come and have a salt.
That's salt bed treatment.
Yeah. But
I want Dr. Mike to get the salt bed treatment.
Oh, right.
He's so tall, I hope he can fit in there.
I was just thinking about that. We may have to have him crunch up. That's very funny, right? He's very tall. But the phone number to call there for an appointment is 954-561-8799. It's a gorgeous spa. You really should go and do that. So, but let's keep going on this because this is it's a fascinating subject.
So I'm going to interrupt you. I can't go to the spa and I can't become a fighter pilot. You know, it's like my dream to become a fighter pilot. I'm too tall, not a spa.
No, the spa, you okay.
You just have to be a cellular, right? So let's keep going with this because this is a very interesting subject. So when people now have this done, does it come back again?
You know, I tell patients this. Venous disease sometimes can be like weeds. You go to your garden, you pick some weeds, and they end up coming back. But it's important to stay on top of it. So, and it's usually just the little spider veins that come back. And this is why at the beginning of the show I said spider veins are sometimes not medical, sometimes they're cosmetic. And when we get older, spider veins appear. So a lot of times we'll clean up the leg as best as we can. Leg looks good. And I tell patients just to follow up once a year, once every 2 years. If there's something there, let's take care of it quickly before it gets bad again. You know.
And you know, one of the myth is that people say, well, you know, the veins only come out if I have babies. So if I'm a woman that never have kids, I shouldn't have any venous insufficiency. Can you elaborate on that?
I can. So actually, we have to talk about risk factors.
Right.
You know? The higher the risk factors, the more you have and the more likely you're going to get something. So risk factors for venous disease are number one, genetics. Look at your parents and grandparents' legs. If they had veins, skin discussions, ulcers, that's a big one. And the second big one is lifestyle. Standing all day for work. Salespeople, hairdressers, anybody who stands for a long time, cashiers, or people who sit for a long time, people in offices. So I always tell them, you know, if you're standing all day, try to sit down for a little bit. If you're sitting all day, go to the bathroom, walk around, get some water. Get some movement in, okay? So genetics and lifestyle are number 1 and 2. And interestingly, the people who stand a long time, are probably my highest number of patients is from individuals who stand for work a lot. You know, so factory workers, construction workers, police officers. A lot of police officers, yeah.
But a lot of us, I have a sit-stand desk, and I stand a lot at my desk because sitting is not good for posture. But now you're telling me it's going to be bad for my legs.
Yeah, but once in a while you should sit down and give your legs some rest.
True, but if I get the compression stockings, it wouldn't matter. Is that true?
It's going to help you, correct.
It's going to help.
Yeah. So then the other risk factors, so those are the two top big ones. Then there is being a woman is twice the risk factor of being a man. Each pregnancy doubles your risk. So 2 babies is 4 times the risk. 50 babies is 100 times the risk. Right? Easy numbers. Trauma, so bad car accidents, surgery that disrupts any vasculature of the legs. So a lot of patients who have knee replacements usually end up having some bad veins. But interestingly, I work with some orthopedic surgeons. And I always say there's the orthopedic surgeons who believe in what I do, and there's ones who don't. And the ones who have seen the change of recovery for their patients send the patients to me, and they always write on the script, knee replacement in 6 months. Right? And I say, okay, I know what they want to do. They want to correct all the vasculature. They want to fix all the veins before they go in there because they know that the recovery for that patient is significantly better. What they want to do is do the knee, and they want you walking the minute after, right? As soon as you're in your room, they're getting you walking, physical therapy, and they realize if you can fix the venous situation, the venous problem, then that patient recovers a lot quicker because you've improved that circulation and blood return. The other thing is, I had an orthopedic surgeon call me and say, look, I cut the skin in this leg and the patient started bleeding all over the table. And I said, yeah, because you just ruptured a varicosity. He didn't see it underneath the skin because the patient's laying down. He sliced open the knee and the patient started bleeding. And I said, what did you do? He goes, we held it. And he goes, I stopped the procedure. I just said, you know what? We'll just come back another time. I took an ultrasound to her knee and she had these massive varicosities everywhere. And I said, let me do this. Let me treat the patient. And then you take her back. Give me like 3 months. And then you can do whatever you want. We closed all those varicosities, corrected the problem. He cut her open very slowly. I heard it in the OR. And he said, I was cutting right through these veins, but they were all closed. You treated all of them. None of them were bleeding. And he goes, I'd replaced the patient's knee, and the patient's doing great. And recovery was impeccable.
Personally, I never put the two together.
I never heard of this, right?
Now that you mentioned that, I do remember one of the patients that we treated. And, usually a person go for a knee replacement, and then they go to rehab, and eventually we do the home visits, and then the patient come back to the office when the patient is up and about. And I saw one of the patients that you treated, and then I cleared him for his knee replacement, and there was no, it just happened that you treated the patient, and now the knee replacement, he went to see the orthopedic doctor, he scheduled him for knee replacement. The guy went for the knee replacement, look, and I see this guy coming into the parking lot without a walker. I say, wait a second, maybe he canceled the surgery. He's coming in. I say, didn't you just have your knee replaced? And he goes, yeah, I'm doing great. And I say, my God, I never seen anybody recuperate this fast. I was amazed. And then he went for his second knee replacement, and it was the same thing. No. And now I put 2 and 2 together.
I understand. Yeah.
What about hip replacement? It doesn't affect that so much, does it? Because
hip replacement too.
Really?
So, like I said, the orthopedic surgeons who refer to me normally send anybody who's doing hips or knees. They send the knees, definitely they want, but because they want that leg to be at the best it possibly can, because you're undergoing a huge traumatic event, right? So if you're battling the recovery, plus you have venous disease, plus you have all these other problems, it's going to be harder for you to recover. Now, if we can get you to feel better, get the veins to where they need to be, now you're not battling that problem. All you have to do is battle the recovery from the surgery.
That's excellent. I want everyone to know, again, I think I should repeat the people, these great stars on the show here. Of course, it's Dr. Luc Maj, M-A-J.
My.
I did it again. I don't know why I do that. I know, it's so strange for me.
My doctor.
My doctor, Dr. Luc Mai, right, Dr. Luc Mai, and of course, our famous Dr. Andre Mencia, right?
Andres
Mencia. I'm not doing well this morning. Andres Mencia, right? Who is, of course, the geriatric physician who is famous for his wonderful world of wellness, and I think this is appropriate name for this segment.
You give me
wonderful world of wellness. Because we're talking about being well, not waiting till we're...
Not waiting to lose a leg.
Exactly. This is a
or
very
be on a
important
wheelchair
part.
because you can walk no longer. You'd be amazed how many people we see on wheelchair that don't belong there.
I'm sure that's true, but let's go back now to these gorgeous...
And it's not attractive.
No, it's certainly not. However, let's go back to the socks.
Look at Richard, how attractive he looks. Can you imagine Richard in a wheelchair? Please, he won't be attractive anymore.
Can we talk about the socks?
Go ahead.
She's excited about that.
How about the marathon
socks.
runner, the Boston?
Yeah, I can't believe that. They wear these you call them socks, but
I call them socks, and they're compression socks, compression sleeves, compression, whatever you want to call them. But
red, blue, green, yellow. What is this?
Polka dot.
Over the break, we just put in Google, compression marathon runner Boston. And the picture that comes up, the first picture that comes up is the winner of the marathon in Boston Marathon. And the gentleman has bright white CEP sleeves on.
As he crossing the finish line.
He's crossing the finish line. And he swears by them. He finishes the race and he says these things made a huge difference. And so we see people all the time now. Maybe you didn't before. Maybe you're thinking, no, people are just wearing these colorful socks. But really, if you go to beach, I live in Delray, I go to beach all the time. I see people running these CEP socks on the beach. I see people running them outside. You see pro athletes wearing them. And so why are they doing it? Or do they have horrible vein disease? They got to wear socks? I don't think so. I think a lot of it is it gives you that extra edge. So you see a lot of the compression sock companies coming out with colorful things, anything they can to get you to wear them, because by having that compression on your leg, it drives the blood out of your leg back to your heart, back to your lungs, so you can get oxygenated blood back down into the leg. The quicker you can move that blood back out, get that oxygen back down, that means the quicker your muscles can recover. Get the oxygen.
But let me tell you something, buddy. Mm-hmm. If you buy it on the internet, you cannot return it. But if you come to AGI, we're going to measure you. We're going to measure because you have to make sure you get the right size. Now, once you have the right size, then you can buy anywhere you want to. But if you can go to Dr. Mai or come to one of the AGI offices, you can measure. You can pick a color, buy your socks. Then you can go to the internet and buy. Now you know what you're using.
Exactly.
So you need the size. You need the right size of the compression stocking. You don't want something super tight, and you don't want something too loose that is going to fall off.
And you have a way to measure?
Well, Dr. Mai had trained the staff so that even when he's not at the office, the patient can come in. They will be measured by one of the staff that had been trained personally by Dr. Mai. I don't even measure. I don't even know. He didn't teach me yet. I'm trying to buy him a cup of tea or something. So
do you ever wear
I'm trying to bribe him.
them yourself?
I have my pair, yes. And when I wear dress socks, well, I'll show you. Let me stand up.
Oh, my gosh.
There we go.
Here go my
fashion show here.
When I wear dress socks, I always wear as high as possible.
Look at that. Yes, he does that.
Always. Because I'm on my feet all day. And I feel better, like you said. I feel I can be more productive.
I wear mine all the time.
You do? All the time. When you're not, with the bare
feet
right now.
I'm not going above my knee now.
No. Okay, that's good.
Don't push
well,
me.
you made a believer in me, and I guess I have to think about all this.
I forgot about the story I was going to tell you, and that is, you said, why don't we give these out as presents? Why am I buying candy and flowers for holidays? So a couple years ago, I came to Chicago to see my family, my mom, my dad, my sisters, my brother, and I said, you know what, let me buy them all compression socks. So I got these nice compression socks. I had the girls wrap them, put bows on them, names. I mean, they look exquisite. Put them underneath the Christmas tree. Comes Christmas, they all open them up, and the disappointing faces, I thought to myself, I've never seen disappointment such as this. And they're like, what are you doing? Can't you buy us some nice presents? Like, what is compression? And so I said this, okay, all right, I'll make you guys a deal. You wear them for a week. Now, it's freezing in Chicago. It's like 0 degrees. You wear them for a week. After the week, you come back. Come back on Friday, because I leave on Saturday. On Friday, if you don't want them, I'll give you $300 cash each. And I'll take the socks. I'll just buy them back off you. So here comes Friday. My mom's already been treated by me. My mom's a huge believer. She came in and got everything done. My mom, she had a very bad venous disease, and now she's outrunning my dad. My dad always already told me, he's like, well, I don't know what you're doing, but you got to stop what your mom's doing because I can't keep up with her anymore. So my mom goes, no way, I'm keeping these. Okay, so I got one. It was my sister. My sister's like, no, I love these. Give me another pair. I was like, okay, and that's $600 already I'm keeping. And I went down the line with everybody in the family, and everybody in the family says, no, we want to keep these. Get us more. And I said, hey, man, this is $300. You can buy yourself a bunch of them. And they're like, no, we're not giving these up.
No, that's quite a story.
And all of a sudden, it went from, give us money to, no, we want to keep these.
Yeah, so it's a beautiful
story.
Valentine gift.
Yeah, Valentine's Day, and it's Venus, right?
Yes.
That's what we said. It's the Venus, right?
Venus,
yeah,
Valentine.
that's perfect. Well, that's really great. Well, we thank
And
you.
and for Valentine, they can come to Stonewater and you
Yes.
can buy a package.
Oh, okay. I didn't know that. It was
Yes,
a
you can
beautiful
buy.
package.
They have beautiful package. They make beautiful arrangement that you can give to your loved one. When I came from Hawaii, I have to get used to saying Happy Valentine to a female, not to a male, because for us in Hawaii, it's also like Day of Friendship. So it's Day of Friendship. So friends will say to each other, man to man, a woman to woman, Happy Valentine, as a friend.
Sure, just
No,
a
it's a
nice
friendship
day,
with
But
right?
yes, but now Valentine is only, I guess, the heart and the marketing is all love.
Right.
But
So you
people
have some
that you
nice
let's
packages.
say people that you appreciate, you can buy a nice package from Stonewater, or you can come by AGI and buy some colorful stocking. The sleeve, we have the sleeve there.
Okay,
Get you a
this
pink
is
sleeve.
beautiful. Well, I'm gonna be seeing you. I'm gonna work on this. I hadn't really thought about it before. I haven't had problems with my legs, but I know there's some little spider veins and probably a few other little things I
Wait
haven't
until we
noticed.
get to the stocking.
Oh
You're going to
my
be coming
God,
to see
I'm
him.
really going to be in trouble now. I'll be showing everybody my legs, right? Here's my yellow. I can wear one yellow, one red, right?
That's right.
You
do
can
something
make some
exciting.
match.
Come see us, like you said.
Yeah,
You know,
thank
insurance
you.
covers for venous
Yeah.
disease. So
Thank you. It's very interesting.
well.
Okay, well, thank you very much for being here with Dr. Mai. And, of course, Dr. Mencia, I know you have to rush off to your patients.
Yes.
And
we
people
have the neurologist today seeing patient, Dr. Pimentel.
Great. And
So
if,
a neurologist on Saturday.
and
and
you
we
can't
have-
even see a neurologist
And
any
we
day.
have
Now you can see one on
the
Saturday.
dentist that specializes in implants, dental implant, working on a Saturday.
Amazing.
Ladies and gentlemen, I mean, this is unheard of.
Barnum himself,
This
right?
is crazy.
Barnum, the elephants are coming in. Thank you very much. It's been wonderful
thank
being
you.
with
Thanks
you.
for having me.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.